What about cholesterol? One thing's for certain is that LDL cholesterol, which is the low-density cholesterol, and the one that's the bad cholesterol, as it goes up, these are American units, but as it goes up, your relative risk of having a heart attack goes up. So if God gives you a higher LDL cholesterol, you'll do worse than if God gives you a lower LDL cholesterol. The one major question for us, what about if somebody who thinks they're God gives you a lower LDL cholesterol? Will that be of any benefit for you? And there are a lot of drugs we can use, and the major drugs that we use are the drug called the statin drugs, which are drugs which cardiologists and physicians love, and in general the public hates. And we'll get to that in question period. But in general, these statin drugs are the major drugs that we use to lower cholesterol. How much should you be on if you're going to treat it? And we'll go through the treatment. Well, this is what we call the rule of sixes, and I'm going to just show you what this means. As we start, let's take a drug that I think most of us have heard of. If you watch the Golf Channel, you've heard of Viagra on the Golf Channel and Lipitor on the Golf Channel. All right, so we'll take Lipitor. If you start at 10 milligrams of Lipitor, you'll have a 37% reduction in your LDL cholesterol. If you go all the way to 80 milligrams, so you double it to 20, then double it again to 40, double it again to 80, you get an extra 18%. We call this the rule of sixes. As you double the dose, you only get another 6%. You don't get, if you start and you get 39% reduction or 37% reduction with 10 milligrams of Lipitor, you don't get another 37% when you double the dose. You don't get another 37% when you double the dose again. You get less and less beneficial effect and actually more and more side effects. Should you treat it? Should the guy who thinks they're gods try lower your cholesterol? There have been numerous studies. This one happens to be from the west of Scotland, where they took people with high cholesterol who hadn't yet had a heart attack, gave them a drug called Pravachol or a placebo, a Smartie, and at the end of the day, less Scots died if they got the Pravachol than if they got the Smartie. All right? What level should you treat? You know, what was shown in this heart protection study, which is a study from the UK, which looked at a baseline cholesterol and said, we're going to give you, if you've had a heart attack, we're going to give you this drug called simvastatin, irrespective of your cholesterol level. Doesn't matter whether you start at 100, which in our units is 2.5, or 129, which is closer to 3, or 130 more than that. We're going to give you simvastatin off the bat. And what they showed is you did better with that drug, irrespective of your starting cholesterol. So if you have a heart attack, the bottom line is your cholesterol is too high for you, and you'll benefit from it being lowered. It doesn't matter if it's in the normal range. It doesn't matter if it's the same as the rest of the people in British Columbia. Bully for you, you'll die like the rest of the people in British Columbia from heart disease, all right? So for you, your LDL cholesterol is too high. It does come with side effects, and Larry, I'll start off to this if we're getting late. It does come with some side effects, and the most common side effect from cholesterol-lowering drugs is something that we call myalgias or muscle aches and pains. Liver problems, elevated liver enzymes, is incredibly rare, and very, very infrequently does it cause liver failure, if hardly ever at all. Muscle aches and pains are common. Myalgias occur in about 5% of people on statins. To be perfectly honest, they occur about 50% of people not on statins, all right? We have muscle aches and pains. So it's quite difficult to know if your drug is causing the muscle ache or pain or not. But they certainly can do that. And what we found out recently is it can cause muscle aches and pains, and there may not be a laboratory test to tell us that it's causing the muscle ache and pain. There's a test that we measure called the CK or CPK, which is a protein that gets released from damaged muscle cells. And if you came to your doctor and you said, you know, you gave me the Lipitor, and now I can't hit a golf ball off the woman's tee because I'm so weak and I've got pain, and the doctor would do a CK and he said, well, you're just getting weaker and older. If the CK was normal, they said it's not the drug. It could still be the drug, even with the normal CK. That's really a new thing that we found out. Having said that, a lot of muscle aches and pains are not from their statins. Just before I end, just going to go through that clearly, lowering cholesterol is not all about drugs. We know that adding fiber to your diet, we can lower LDL cholesterol. Adding soya protein to the diet and adding some other kinds of things, you can lower LDL cholesterol down significantly. The last thing to be aware of is that there's another type of cholesterol called HDL cholesterol. And HDL is the good cholesterol. You want your H's to be high and your L's to be low. And what we know again is that if God gives you a low HDL cholesterol, you're going to have a higher risk than if God gives you a high HDL cholesterol. What we really haven't shown yet is that any one specific drug improves this. We really haven't shown. What we do know how raises HDL cholesterol is diet, exercise, and we hope that red wine does, and we're going to defend red wine until the cows come home. All right? But there's some evidence that red wine raises HDL cholesterol. So, Larry, I think in the interest of time, I know we're running late, I've got a lot more to discuss because preventative cardiology, we could spend here for a year. One thing to remind you all is that there's nothing more, if any of you are smokers, there's nothing more beneficial that any of you could do than to stop smoking. If you come in to the hospital with a heart attack and you're a smoker, you will actually do better than if you come into hospital with a heart attack and you're not a smoker. That's because if we stop you smoking, it's by far the most powerful risk factor modification that we have. The other ones, like cholesterol and blood pressure, pale into insignificance compared to smoking cessation. So I'm going to leave it at that, and we'll leave it for question period about exercise or anything else that you can lower risk with. Thank you.